I'm Stephanie, a PT with the Note Ninjas, and together with Nicole, the OT, we help other therapists with treatment ideas and documentation. So today, we're going to talk about resisted ambulation. So I'm going to use this resistance band. I'm going to be the therapist, and Nicole is going to be the patient. So what we can do is I'm going to hold it for this demonstration, but if you have somewhere you can put it onto or some kind of sturdy surface, but I'm going to hold it, which I like anyway, because I like to be close by and I'm in control. So I'm going to put it around her waist, and I would give her resistance, and she would walk forward. So walk forward, and then I'll have her slowly walk back, so she doesn't go with the resistance. Good. And then she can walk forward again, but I can even give her resistance from different directions. I can do direction changes, and then have her walk back. You can even have her go sideways, so she could turn. Go this way. There you go. Walk that way, straight out. And then again, coming back in with the resistance. So this is really great for trunk stability, especially when turning her in different directions. She really has to use her abs or core muscles to control the direction. Walking out is hard, she's pushing against it, but walking in and coming back is just as hard and maybe harder to go against the resistance. So the core stability, core strength, is really working on the hips. Really a lot of proximal control. So I'm really getting her all her proximal core stabilization muscles on this. And this is hard enough straightforward, but then when I start doing it side to side, it's really testing her. But this is an example of when she's outside on uneven surfaces or walking on the grass. Maybe your patient is walking their dog and they need that, they're pulling them in all different directions. And if you want to upgrade it and maybe make it more functional, we can even use the activity like sweeping. So I'm going to give her a broom, this back around her, and we have a ball on the floor, and I'm going to give her resistance while she's sweeping up the broom with the ball or anything else, just giving her some resistance there. She could even go back again. So again, it's core stability, core strength, proximal control, really getting those different angles. It works so many different areas, and our patients have a lot of fun with this activity. And then just make sure you're documenting what you're doing and why. What kind of cues were you able to progress to changing directions? Did your patient require assist when they were going backwards because they couldn't stand the resistance and you had to help them? What did you do during the activity? Remember, it doesn't really matter all the sequence of the activity you're doing. It really matters for what functional activity and what you did as the therapist. So make sure to follow us at the Note Ninjas for more treatment ideas and documentation tips.